This is like the fourth version of this that I've done. Now, there's a side note here that I haven't been doing videos for a while, right? And there's a bunch of different reasons, and they're all overlapping, and people don't understand their own motivations. But thinking quite carefully, what's the real deep reason that I haven't been doing videos for the last couple of weeks? Because the things I want to talk about make me really angry, like walking in a black rage all day long, angry, and I don't want to live like that. So, in order to avoid that self-poisoning rage, I've avoided making these videos, but some things gotta be said. And the reason is I'm saying stuff in this video. What you're gonna see here is a sanitized version, but I'm gonna start with the beginning of the lockdown in Canada. Does anybody remember when we were gonna flatten the curve? That was the phrase, flatten the curve, right? What did that mean? That meant the curve, the rush of people going to the hospitals, to the intensive care units. Well, that rush didn't happen. There was never a flood of patients. I mean, there were places that were set up with like hundreds of emergency hospital beds with isolation units set up in like loading bays of convention centers and stuff like that never got used. Because there was no flood. And the flood of patients, the hospitals are overwhelmed. We had to flatten the curve, not prevent the hospitals from being completely overwhelmed, while there was no treatment and no cure, and nobody knew how to deal with COVID. And all those lockdowns, this draconian shutting down of society and shutting down of the economy, that was emergency measures because we didn't know how to deal with COVID. Well, now there's treatments, right? Now there's treatments. We know how to deal with it. It has a very low mortality rate. In fact, 99.9% of all of the deaths, all of the infections and the deaths are people with pre-existing complicating conditions. They're extremely old, they've got a compromised immune system, they've got long-term respiratory damage, and pile COVID on top of that, and just too much for some people. Everybody else seems to recover quite nicely. And I'm not diminishing the seriousness of this disease, but we are acting like we don't have a treatment, we don't know how to deal with it. We're acting like this is a new and catastrophic disease that we now do not know how to manage. But we do, and yet we have not modified our policies except to continue to shift the goalposts around. You also might remember that at the beginning we were told we don't need masks. Don't buy a mask, don't wear a mask in public. It doesn't do anything, you don't need one. And then within 3 weeks, oh yeah, you do need a mask, go get one. Everybody needs to wear one. And of course the lie was told to us that you don't need one because our health officials and our politicians wanted to preserve the availability of the limited supply of masks for healthcare workers and hospital employees and so on. Well, okay, fair enough, right? I understand the reasoning of doing that, but shipped along with that is a parallel understanding that the information we are being provided by our public officials and our healthcare, authorities isn't to inform us, it's to control our behavior. So every single other thing that we're told after the reveal of, oh yeah, we were lying about you don't need a mask because we just wanted to preserve the masks for healthcare workers, hospital employees, well then every single other thing they say from that point on has to be viewed through the lens of you're supplying information not to inform but to control people's behavior. Every single other thing that our public officials say after the reveal that they're lying to manipulate us has to be viewed as you're lying to manipulate us, even when they're telling the truth, even when the information is truthful. It's being supplied with the intent to control, not the intent to inform. And if that doesn't make you angry, you might already be a slave. If that doesn't make you angry, you might already be a slave. And the masks, there's a huge amount of evidence now from very reputable medical professionals that the masks don't do a damn thing. They don't do nothing. I mean, they might be effective when put on and taken off in a very particular order with a very particular procedure that medical professionals are trained to use. But we average dirty civilians who put our mask on, take it out of our jacket pocket, put it on when we get on the bus, put it back in our pocket, take it on, fuss with our face because we got an itchy nose, the edges pop up so your air is going out the sides. They don't do a damn thing. Certainly not the way a civilian, untrained, dirty pedestrian like you or me uses them. The masks are symbolic. They're not practical. They are a muzzle. They are to condition you. They're to make you docile. They're to take your face away from you, to take your voice away from you, to condition you to obey restraints on yourself, actual physical restraint of your face. Oh, sure, it's soft, but it's still a restraint. To condition you. It doesn't actually prevent transmission. It doesn't prevent infection, because in order to do so, you'd have to be specifically and rigorously trained to put the masks on and off in a sterile environment with a sterile procedure, the way a surgeon does when about to perform surgery. Not the way you do when you're shopping at Walmart and you have it shoved in your coat pocket along with a dirty handkerchief, and your hands are dirty and you fuss with your face and it doesn't fit properly and you're rubbing your, all of this is theater. Anyway, that's about all I'm going to say right now, because if I go any farther, anyway, thanks very much for watching, and as always, have a lovely